to provide an update regarding the coronavirus and the steps we are taking here in Florida to stave off any potential outbreak. Now, first and foremost, there are still no cases of coronavirus in Florida. This is a rapidly evolving situation, and we're carefully monitoring in conjunction with the Federal Centers for Disease Control and Prevention and Department of Health and Human Services. Our response will evolve based upon updated information and guidance from our nation's top experts in communicable diseases. All levels of government, have been engaged in efforts for the coronavirus. Now, at the end of January, HHS Secretary Azar declared a federal public health emergency. The goal of the declaration is to prevent entry of coronavirus into the United States and slow the pace of any outbreak. We had been working on this really since the beginning of January, right after the stuff became known in December, and Dr. Rivkees and his team's been engaged since the beginning of January. But that declaration, I think, was important because foreign nationals who visited China in the past 14 days are not allowed to enter the United States, and then flights from China are being directed to 11 international airports across the United States where Customs and Border Patrol and CDC are conducting screening. None of those airports are in Florida. So individuals returning from Hubei province after February 3rd currently have a mandatory 14-day isolation at a federal facility. Individuals returning from other regions of China after February 3rd receive an initial health screening upon arrival. They are not ill. They can continue to their destination, but they are given instructions for self-monitoring and are asked to have self-isolation for 14 days from the time they left China. Now, states, including Florida, are notified as to these individuals, who they are, by the CDC for monitoring and follow-up. Department of Health personnel and county health departments contact these individuals, perform an assessment, and monitor the isolation process. If any get sick, they will be referred for medical care and for evaluation. The Florida Department of Health has been fully engaged from the beginning with their response and epidemiology teams working on this issue since the first weeks of January. We have an incident management team in place and are working lockstep with the CDC, receiving multiple updates daily. Hundreds of dedicated DOH professionals are engaged to respond, including staff in Tallahassee's central office and each of our 67 county health departments. Our fully integrated county health department system allows us to respond quickly and accurately. And we've also engaged the medical community through correspondence and weekly calls, and have established a DOH website related to the coronavirus at www.floridahealth.gov/COVID-19, COVID-19. This is the best and most up-to-date source for information and guidance regarding the coronavirus for Floridians, and I think they've done a really good job laying out a lot of good information. Now, if there's an individual with suspected coronavirus, CDC and DOH protocols are in place for healthcare providers. The first step involves the healthcare facility immediately contacting the local county health department. The individual suspected to have the virus will be evaluated at a local hospital following specified precautions. DOH collects samples and sends them to CDC. We anticipate that eventually those tests will be able to be conducted in Florida. We're waiting to get the proper equipment for that, but as of right now, it's all going to Atlanta. Direct contacts of the individual will be identified in the event that the person has the coronavirus, so these individuals can also be isolated and monitored. The bottom line goal of public health response for this virus is containment and to stop person-to-person transmission. And as I said, we've not had any cases in Florida yet of people testing positive. As discussed in our recent calls with healthcare providers across the state, practitioners and healthcare facilities have been asked to refer to CDC guidelines for healthcare professionals to ensure that their facility is properly prepared and that they have assessed their materials and material needs for possible cases. Dr. Rivkees can talk. They've made sure that they are stockpiling relevant equipment, which is important. Please note that we strictly respect the confidentiality of individuals who are either persons under investigation or those individuals who are under self-isolation having returned from China. That is what is required by Florida law. The state of Florida is fully committed, doing everything we can to prepare and respond for the coronavirus Obviously, if there is, and hopefully we don't have any identified cases, I mean, that obviously will be something that we would immediately notify the public about. So, what we're doing here is from the very beginning of January, we didn't know what shape this would take. We wanted to be prepared. The Lieutenant Governor, Dr. Rivkes, and their teams have done a good job. We've worked very well with the federal CDC and federal HHS and the President on it. And so this is, I think, to be prepared. But as of right now, given that we've had no infections, the CDC considers us to be at a low risk. But that doesn't mean that you don't want to plan for any potential transmissions. And so with that, I'm going to invite the Lieutenant Governor to make a few comments.
Well, good morning. Thank you all for being here. I want to thank Governor DeSantis for his leadership on this issue, as well as our team at DOH, the Surgeon General, along with the entire County Health Department. They have been extraordinary in preparing for this. As you heard, Governor DeSantis, I think it's important that we reiterate that there are no confirmed cases in Florida. At this time, we continue to monitor with CDC. We continue to work with HHS in making sure we're following all of the guidelines as this is rapidly evolving. And so we will adapt and we will make sure that we are following those guidelines to a T. DOH personnel in each of our counties have been instructed to make sure that they are informing the public in terms of anything that would transpire in the future. They want to make sure that as they continue to engage in the strategy of containment and isolation, that is something that our local county health departments are well prepared to do. We have an incident management team in place, working in lockstep again with the CDC. So that is something that we are doing daily, if not hourly. I know Dr. Rivkes has been in constant contact with them, and that is something that we will continue to do again and inform the public as needed. Our fully integrated county health department is really best prepared to manage this at the local level. As the governor mentioned, the best source of information is our website at www.floridahealth.gov. /COVID-19. That really is the best source of up-to-date information. It is constantly being updated. Again, if there are individuals with suspected COVID-19, the protocols from CDC and DOH are in place with our healthcare providers. They are constantly communicating with our hospitals, with our healthcare practitioners to make sure that they immediately contact the local county health department. Those individuals will then be evaluated at any local hospital, again, any local hospital, following specified precautions. Really the goal, again, is containment in order to stop a potential transmission of this disease. Again, I just want to reiterate the state of Florida is doing everything in their power to make sure that we prepare and respond in the event of a COVID-19 case. So with that, I would like to turn it over to our State Surgeon General, Dr. Rivkes.
Thank you. Thank you, Lieutenant Governor. Governor, thank you all for being here today. At the onset, I'd like to acknowledge the tremendous contributions of the members of the Department of Health team who were with me today. I'd like to also begin by extending my thoughts for the Americans and individuals worldwide who've been sickened by COVID-19 and those who have lost loved ones. As the Governor, Lieutenant Governor mentioned, there are no cases of the novel coronavirus or COVID-19 in Florida. This is a new virus. This is an emerging and rapidly evolving situation. Since this virus first appeared at the end of November, the Center for Disease Control, or CDC, and Health and Human Services, or HHS, and the Florida Department of Health have continuously monitored and provided updated information about this situation. This week, though, HHS and CDC changed their messaging. First, they continue to emphasize that the immediate health risk for COVID-19 in the United States is low. However, we need to be prepared for more cases and potential community spread in our nation. Preparing for these situations is something that we do every day in public health. This is what the Department of Health activities are all about. The Department of Health, other state agencies, the medical community stand ready to help protect and care for the public. As mentioned, we have a Department of Health website. This has links to the CDC, please refer to this for the latest up-to-date information. Also, as we have confirmed cases in Florida, this information will be posted on the website. You can only contract this virus from an individual who is infected with it. It is transmitted by the respiratory mode. It is more infectious by the flu. The mortality rate is about 2% versus the flu, which is 0.1%. The incubation period on average is about 6 days, but it can go up to 14 days. It can cause both upper and lower respiratory symptoms such as cough, shortness of breath, and in some situations, pneumonia. The highest complication rates are in the elderly and those individuals with underlying medical conditions. Based upon the available information that we have, in 80% of the time, this situation is going to be mild. 15% of individuals will develop severe illness, and 3% of individuals will become severely, critically ill. Thus, most individuals who will have COVID-19 can be cared for at home. As the governor mentioned, there is no vaccine for COVID-19 at the present time. A vaccine is under development per CDC. This will be more than a year away. There are currently no antiviral medications for COVID-19. Thus, treatment is going to be symptomatic. Stay home, be hydrated, control your temperature, and take precautions so you don't spread this virus to others. Worldwide, there are now more than 80,000 individuals with COVID-19. Most of these individuals are in China, but there are now more than 3,000 cases in 37 countries, with South Korea, Italy, Iran, and Japan following China. Per the CDC, there are 14 individuals in the United States with COVID-19. In addition, there are 42 individuals with COVID-19 who are on the Diamond Princess and are currently quarantined. In terms of what actions are being taken place, this is happening at many different levels. The Department of Health has been fully engaged from the very beginning with our response and our epidemiology teams working on this since early January. Similar to how the state has responded to other public health emergencies such as the H1N1 flu epidemic, Ebola, and Zika, the Department of Health will lead the state response, working with other state agencies. We have fully operationalized our incident management team on this. We are working with the CDC, receiving multiple updates on a daily basis. Hundreds of Department of Health personnel are engaged to respond. This includes members of the Central and our 67 county health departments. Our fully integrated county health department system allows us to respond quickly and effectively in events like this. We have also engaged the medical community through correspondence and calls. Yesterday's call had more than 500 participants. As discussed in our calls with healthcare providers in our states and practitioners, healthcare providers and facilities are asked to be sure they are up to date with current CDC guidelines. Make sure that you've assessed your material needs as well. The strategy for our response will have different layers. This will vary depending on circumstance. If there are individual cases or linked cases, our strategy will be sure that these individuals first have the medical care that they need and that they are isolated so they cannot transmit this virus to others. However, if there are multiple unlinked cases or there appears to be widespread COVID-19, community-based strategies will be implemented, and this will involve avoiding group activities and group meetings. Again, as mentioned before, I wish to emphasize there are no cases of COVID-19 in Florida, nor is there any evidence of community-based transmission. What can the public do to be prepared? First, again, refer to our website. Remember that this is a respiratory virus transmitted by coughing and sneezing. If you are sick, cover your mouth when you cough or sneeze. Do not go to work when you are ill. Be sure to wash your hands with soap and water for 20 seconds after being in public places. And if you are ill, take plenty of fluids and control your temperature. For those who are taking medications, make sure you have a supply of your medications at home. Also wish to emphasize, make sure that you have your flu shot. We are in the midst of a serious influenza epidemic in the United States that has infected more than 20 million individuals and has killed more than 12,000 persons as well. Make sure you are protected against the flu. You are much more likely to get influenza than COVID-19. The symptoms can be similar. Again, I wish to thank the incredible members of the Department of Health and our county health departments, thank our state and health community partners who are devoting considerable efforts to the situation. I again wish to thank Governor DeSantis, Lieutenant Governor Nunes, and the Florida legislature for their support. The state of Florida is fully committed to do everything we can to prepare for and respond to COVID-19. Thank you.
Great. Anybody have any questions?
Governor, can you tell us if anyone has been tested and how many people have been tested based on the language you use? It appears there have been.
So I don't think I'm allowed to kind of go into the numbers, but let's just say from the beginning of this in January, you know, Dr. Rifke's, you know, we've been monitoring people coming in. Obviously, HHS has said, hey, this person may have been in China, and all those people were monitored. Anybody that tested negative, and that's just been true up until this point. So, but I'm mindful of, I actually wanted to give all the numbers, but they pointed me to the regulation or the statute that said you can't list all the numbers. So
why can't you list the numbers? I mean, you're not identifying any particular people.
that's just what, you know, Rivke's and their team have looked at it and said that that's the way to go. So
well, some people have said that the lack of transparency is undermining your efforts to reassure the public. So
I don't think so. I mean, you know, in January we were out. I gave an update. I had said at that time that the travel restrictions would be helpful and that anybody coming in would be tested. Up to that point, we had some tests that I said they've been all negative. So we've been given periodic updates, but at the end of the day, you know, to this stage, there's still not been any transmissions documented in the state of Florida. If that were to change, then obviously Dr. Rivke's and my administration would want to let people know that ASAP.
Governor, you mentioned the screenings at other airports outside the state for China, for people traveling from China, but what about Orlando International Airport, Miami?
So if you're,
are they going to start screening for places like Brazil or Italy that have?
I don't know if there are. Dr. Eusebio will speak to that, but I mean, I think in Brazil, I think there've been like a handful of cases. Obviously, a very big country. Any of the China flights. You can't fly into Florida right now. They're being diverted to these other areas, and I think that that's appropriate. And I think that the federal government should be willing to potentially expand if necessary. But I'm not sure that it is quite necessary anything in terms of Florida yet. But I was definitely glad that they initially decided to divert those flights. That made it a lot easier for us because we were notified about who was coming in from who had been traveling in China, particularly in the Wuhan section.
And what
Well,
about
no, flights from Italy and
Japan, South Korea?
exactly.
Well, obviously, you know, that's going to be a determination that is going to be made by the federal government, and they need to make those. I mean, I would err on the side of caution on that, but I don't know that there have been as many cases there as there have been in the areas where those travel restrictions are.
You said this report that a man who got tested for coronavirus ended up with a $1,400 tab. Have you guys been discussing ways that if people need to be tested for the coronavirus to make it more affordable for people? So
if you are, say, being monitored, and you're in like a 14-day period, and I'll let Dr. Rifke's add to this, you know, the Department of Health is cognizant about if you're in isolation, you may need to go earn income and you can't do it. And so they have programs in place to try to mitigate, you know, some of those costs. But I'll let Scott maybe talk about.
Thank you for your question. So this is what we do within the Department of Health. We will work with local healthcare facilities on issues similar to this.
But this program, can you just, I think we're kind of, what we would like to know what the state is doing if people are being isolated for 14 days, or if you're sick and, you know, we have large uninsured rates, really what are you doing for those people? I don't think I heard a description of the program.
Yeah. So if an individual would be suspected to have COVID-19, and they're under isolation, the Department of Health will work with those individuals to make sure that they have the health care that they need. If there are special circumstances where these individuals need help with food, things like that, we will be there to assist
Why
them.
not declare an executive order saying that they can all be written off as charity care patients if they're uninsured?
At the present time, we have no confirmed cases of COVID-19 in Florida. There's
But
no
we're
community,
preparing for it, right?
there's no community spread in the state of Florida. However, if things change, we will reevaluate the situation.
Okay, speaking of statutes, Governor, you said that you would let the public know if there was a case of somebody contracting the virus, but the statute appears to leave it up to the discretion of the Surgeon General, as we saw with some of the hepatitis A cases. So are we going to change the law this session so we define that more clearly, or are we going to continue to leave it up to the Surgeon General? Like, what is the threshold here?
Clearly, if there's a documented case, then that would be something that is going to be disseminated. Obviously, not the personal characteristics of the patient, but that would be an easy thing to do, and so that's what we're planning on doing it.
Just for argument's sake, let's argue that you have 5 people being, in isolation in Broward County, for argument's sake. Why doesn't that rise to the level of sharing that? You're not releasing personal information. There's no HIPAA violation in saying,
Yeah, look, I think I think this is the statutory scheme as exists now.
It's
So,
optional.
But why?
It's optional. You have the ability to do it, and you're
Yeah, I wanted to speak to
I mean,
this.
we're in the middle
Yeah.
of session right now.
Yeah.
Conference hasn't
Yeah,
even begun.
so important discussion. So there are 3 criteria by which we can release information. So first of all, like when each of you go to your physician, you have rights for confidentiality. The physician is entrusted with honoring that confidentiality. So 1, and this is defined in statute, it has to be highly infectious of nature. At the present time, coronavirus is viewed to be moderately infectious. Measles is something which would be very highly infectious. Influenza coronavirus are considered at the present time to be moderately infectious. Second, there is a risk of public spread. You can get coronavirus only from somebody else who has coronavirus. And without there being cases of coronavirus in Florida, it's not going to be spread. And the third is, if there is an individual who, let's suppose, has COVID-19, and you cannot identify the contacts of those individuals, and you need to notify them, then we can do this. This is a situation that is dynamic and is rapidly changing. And if those circumstances change, then we absolutely will make the public informed to protect the public. But at the present time, we don't have community spread in Florida. We don't have coronavirus in Florida. So the law dictates that we protect the confidentiality of individuals at the present time.
Doctor,
Again,
Just let-
there is somebody here in this room
Okay.
right now who has.
Bobby, you've already asked questions. Anybody who has.
Dr.
Governor,
Rifki's,
right here in Tallahassee, we've had a company that manufactures compressors. They're planning a temporary shutdown. Do you have a sense of the economic disruption from coronavirus, from supply chain?
So I think that if you talk to the medical folks here, there's no evidence that shipping something from China that would transmit the virus. Now, I'm not going to say people aren't going to react. I mean, obviously, you see the stock market, but there's no evidence that if you shipped a pile of goods or parts, that people in receipt of those would then be able to contract the virus. And so I just think it's important to understand that. And if there were different guidance on that, obviously we would let people know. But I mean, it's
but how did you guys
virtually
select the
non-existent.
people who got tested? Can you just tell us more about how you selected those people? Did HHS contact you because they flew in from China and then you held them when they came to Florida and tested them?
Yeah, I won't comment on any individuals specifically, but in terms of what's happening. So if an individual was on flights that have gone into these 11 airports where they've come in from China, the states around the country are notified who those individuals are, and then those individuals have been asked by CDC, Custom Border Patrol to self-isolate. And then those individuals will be contacted by Department of Health personnel to ask them to monitor their medical situation and to help them with the self-isolation process.
Can you clarify how many people the state has been notified of? I'm not asking details other than.
And they came to
large
Florida,
round
right?
number.
Like they flew in somewhere else and came to Florida? That's what the governor was saying, they were diverted?
Yeah, so right now, flights from China are going to 11 airports in the United States. When individuals arrive, they're screened. If they come from Hubei province, which is the hot zone area, those individuals go to mandatory federal quarantine. If those individuals are not ill, they're given cards and are allowed to transit to their final destination. Those individuals are asked to self-isolate for 14 days. And those individuals will then be contacted by Department of Health personnel instructing them how to self-monitor and see if they have any specific needs.
Again,
Thank you, everyone. Thank
So
you,
how many of
everyone.
those individuals
Thank you.
came to
Alex,
Florida?
thank you. We'll get-
Why can't we get one number? How many?
Thank you, Alex.
All
Thank you,
right,
everyone.
thanks.